Welcome to BirthRight, a podcast series by BirthRight Hospitals by Rainbow, where we will be discussing about fertility and pregnancy beyond the consultation rooms. I'm Dr. Niharika, an IVF specialist at BirthRight Fertility. And through this series, we are opening up conversations about the struggles that couples face quietly. So, along with me is Dr. Swathi. Hi, Dr. Swathi. So, she is an IVF specialist at BirthRight Fertility too.
Thank you for having me in this conversation, doctor.
Yeah. So, many times, Dr. Swathi, couples, we do all the investigations, basic investigations, and all the reports turn out to be normal. All the tests turn out to be normal. Then we help the couples explain that the reports are normal, but then we explain that it is unexplained infertility. Yes. So the first fear that they see is that unexplained infertility means there's no reason exactly pointed out with the investigations that we have done.
Yes, very true.
And that is very devastating to the couples because they have gone through a lot of investigations and yet they are still not able to have an answer for why they are not able to conceive.
Yes.
So how do you explain this in a simple term to the couples?
So, yeah, like what you have explained already, unexplained infertility is where we are unable to find a cause, but the couple are still not yet pregnant or they have not got a good result. So, we do most of the tests, but what I would like to say here is the tests that we do amount to only diagnosing 60 to 70% of the factors that are really required for fertility.
Right.
So, I would not like to say unexplained infertility as a problem which has no cause. I think it is better to put it in words where I would say that it is something where there are minute problems, but those minute problems are not picked up by the test that we do.
So what are the factors most commonly that we see in an unexplained infertility, or what could probably be the reasons or invincible factors that we see?
So the diagnostic or the evaluation test that we do only amount to around 60 to 70% of the factors. So these are gross things that we look at. Say, for example, I am doing a test for a tube. I am only seeing if the tube is open or not. Or if I am doing a series of scans for the patient where I am seeing for a follicular growth, I am only seeing if the follicle is growing and if it is getting ruptured. But there are certain microscopic events also which have to fall in place for a couple to get pregnant. Like the tubes should function, the tubes should push the egg towards the sperm, or in that case if a follicle is rupturing, there has to be an egg in that follicle, or there has to be a proper interaction between egg and sperm when they meet. Implantation, the sticking of the embryo to the uterus is also important. So all these minute factors which happen at a microscopic level are not diagnosed. There are certain tests, but not most of the tests give us a definitive diagnosis of where the problem is. So this is a gray zone where we usually miss out on diagnosing what the minute problem is. So in short terms, unexplained infertility is like a microscopic problem that is not being diagnosed yet.
The diagnosis often brings a lot of doubt or self-doubt upon the couple. Sometimes it would have been that they got tested a little late. They wanted to have a natural pregnancy, but they took time to get tested. So at that time, whenever they have found out that it is unexplained infertility, the first thing that they come is they have a self-doubt. Doctor, did we wait for a very long time to get tested?
True.
So what do we explain or how do we counsel those couples at that time?
Yeah, so this self-doubt and regret, most often couples, when we tell them that this is the problem or we are unable to diagnose a problem, the question that comes is, did we come too late or should we have planned a little earlier? So I would not say that it is really important to dwell upon it. We have at least come now. We have started the treatment. So we will always look at it in a positive way. And yes, so unexplained infertility doesn't mean there is a hopeless situation. It doesn't mean it does not have treatment. Almost 30 to 40% of these couples with proper care, support and continuous guided timing or guided scans and treatments, they conceive over a period of 1.5 years. Definitely there is a large amount of stress that sets in when we tell them about these diagnoses. About almost 40 to 60% of them have depression or anxiety symptoms, but it is not a hopeless situation. I mean, a lot of them conceive with simple treatments as well. So, Dr. Niharika, like we have talked about this, and in unexplained infertility, how is it that what treatments do we suggest these couple? I mean, when we are talking that you still have chance, should we just tell them to keep trying naturally? If they are trying naturally, for how much time do they try naturally? Or is IVF the only solution for them? Or when is IVF suggested in these cases?
So whenever we've come to a conclusion that it could probably be an unexplained infertility with the basic workup that we have done, so we would like to help and if the investigations are pretty normal or completely normal, then we can just give them the support that they require, emotionally support them, and then reassure them that there is still a chance that you can conceive. So keep trying, and probably with a close monitoring, as you've already mentioned, that we can help them have a timed intercourse with the follicular studies that we do, and that will decrease the stress that the couples also face when they are trying. So with that they can decrease, and I would say at least they can try for like 3 to 6 more months, and then go ahead with the treatments if by then also they have not conceived, as around at least 30% of the couples, even after the diagnosis of unexplained infertility, there is a probability that they can conceive naturally.
And when do we suggest IVF?
IVF is something, in IVF, basically it is that the fertilization process is done outside. So we, when we have tried the basic treatment as in the ovulation induction and also the IUI cycles, and still the fertilization isn't happening somehow, so then we suggest the couples that IVF will help have a fertilization. Why? Because even for the ovulation cycles or the IUI cycles, we are not sure whether the fertilization has happened or not. So that is the basic or first thing that we have to understand. And in IVF, we can help them achieve the fertilization in the lab. So that is when we generally suggest them that IVF is an option. And definitely it's not a last resort for them, that IVF only is the option for the couples who have suffering from unexplained infertility. For someone who has been trying since a very long time, and then they are emotionally exhausted with the trying part and still they've not achieved a pregnancy, what would you want to know from this podcast today, so that it will be helpful for them to try with confidence and achieve a pregnancy?
Yeah, so more often, not always, we face unexplained infertility. Around 10 to 20% of the couples have unexplained infertility who approach us. But yeah, it is not a hopeless situation, like we have mentioned. How you have rightly said that different kinds of treatments, preliminary treatments, basic follicular studies, scanning, timing the intercourse, or maybe IUI procedures, or in cases where we expect there is a fertilization failure, IVF, all these treatments have a very positive impact and good chance that the couple can conceive. I know it is a very tiring journey, because in fertility, the couple invest a lot of time, their emotions, to some extent a lot of money, but the answer from most of us is yes, it is a little uncertain, we will have to wait for the result and see. So that is the most frustrating part for the couple, but they should understand that this is a time-taking treatment, and not always it is a hopeless treatment. There is light at the end of the tunnel. Don't have to get depressed. Unexplained infertility, I think what I can say is, to put it rightly, is just that the technology has not advanced enough to find out the problem or to know the complexity of how the nature works in giving a pregnancy, and it is not that they cannot conceive.
Hopefully we find some science future so that the couples with unexplained infertility find an investigation where we will be able to help them exactly tell what the problem is.
Yes, and it makes our job a little
easier.
I'm waiting for
and less frustrating sometimes.
Yes.
As we wrap up today's conversation, it clearly stands out that unexplained infertility doesn't mean a hopeless infertility. I thank Dr. Swathi for the conversation today. Until next time, please take care and stay safe.